For those who are arriving right now, we are rapidly filling up. I think we've got registered close to 500. My name is Peter Tabuns. I'm the MPP for Toronto Danforth. I'm here this evening with my colleague, Rima Berns-McGown, who's the MPP for Beaches East York, and we'll be co-hosting tonight's webinar about the vaccination plan for the East End, and also just generally to answer questions about the whole vaccine issue. Before we go any further, I'm going to turn this over to my colleague Rima for the land acknowledgement. Rima?
Thank you so much, Peter, and thank you to all of you who are here. I know that this is uppermost in many people's minds, so thanks to those of you who are speaking tonight and those of you who have taken the time to come and find out the answers to your questions. I want to begin by acknowledging that we are gathering here by Zoom on the traditional territories of the Haudenosaunee, the Anishinaabe, the Huron-Wendat, the Mississaugas of the Credit, and that we recognize that the enduring presence of First Nations, Métis, and Inuit people. Importantly, this is also the Dish with One Spoon territory, which speaks to the importance of all of us helping each other, beginning with the most vulnerable among us, and that's exactly what we're here to talk about this evening. So tonight, we're going to have brief presentations by our guests, and then we're going to focus on your questions. We've received many questions in advance, and they've been provided to our guests, who are going to try to address the most pressing and the most common ones in their respective areas. And then we'll be going through the questions that you post through the Q&A function and getting as many done as we can. And our wonderful teams who are working in the background are going to be trying to group your questions so that we'll be able to respond to as many of them as possible.
Thanks, Rima. The vaccination plan for the East End has been developed by Toronto Public Health and the East End Toronto Health Partners, an Ontario health team, and they will be the people actually carrying it out. And I'm going to introduce the first two panelists. First, from Toronto Public Health, the COVID-19 Rapid Response Team, I have Marina Tchistaia. She's a member of the COVID-19 Outreach Response Team, a special project launched by Toronto Public Health in response to COVID-19 spread. Her group provides information sessions about COVID-19 to residents online and by telephone. And also Jason Altenberg, who many of you will know. He's the CEO of the South Riverdale Community Health Centre down on Queen, member of the steering committee that leads the East Toronto Health Partners, which is an Ontario health team. This team serves East Toronto, and he's also chair of the East Toronto Health Partners Anti-Racism Working Group. Rima.
Thanks, Peter. I have the great pleasure of introducing Dr. Adil Shamji from Michael Garron Hospital. Dr. Shamji is an emergency physician at MGH and the medical director of the Enhanced Shelter Support Program, an initiative that is delivering primary care in 8 of Toronto's shelters. Part of his role involves helping prepare for the vaccination of individuals experiencing homelessness, which has already begun, if I understand you correctly. He holds an undergraduate degree in microbiology and immunology, a master's degree in public policy from the University of Oxford. He's passionate about health education and promotion, and recently collaborated with Health Access Thorncliffe Park to address questions about vaccinations in that community. And we're so lucky to have all of you here tonight. I'm now going to ask Marina Tchistaia to make a short presentation and to ask Rob to set up share screen for Marina.
Good evening, everybody. This is my deepest pleasure to share the panel with such distinguished panelists like Jason and Dr. Shamji, and to represent the Toronto Public Health and COVID Response Outreach team today. I'll do a very brief presentation, hopefully addressing the most commonly asked questions about vaccination. As we know, just recently we got an update on Friday, And now we have not only 2, we have 3 vaccines available, which have been approved by Health Canada. This is Pfizer, Moderna, and AstraZeneca, which has just been approved this past Friday. They all meet safety and quality standards, and this is Health Canada have a very refined process of reviewing the applications and making sure they meet all the requirements to be safe and effective for everybody. And those 3 vaccines, depending on the vaccine, they showed to be 62 to 95% effective, which is a pretty good amount of effectiveness and safety, which was shown in most of the clinical trials. And we are gonna hope how they're gonna to be the same effective in real life situations. And for all the 3 vaccines, these are the 2 doses schedule which are required to achieve the maximum efficiency. They've been approved. There is a slight difference of ages. So when Pfizer was approved for 16 and over, Moderna and AstraZeneca, they are looking, the most clinical studies were done for people 18 and over, and that's why Health Canada just follows the same schedule which were produced by manufacturers, and this is approved for people 18 and over. And if people want to receive it in a different age category, which is younger, they just need to discuss it with their healthcare professionals. So it's just to be extra safe, they're talking about this age, but children discussing with the health professionals would also be considered. The 2-dose schedule goes from a couple of weeks between 2 shots to 2 to 12 weeks for AstraZeneca. For all of the vaccines, after receiving even the second shot, we were looking at 1 to 2 weeks extra waiting time to make sure they develop enough protection for immune system for individual. Regarding vaccine safety, vaccines were shown to be safe for seniors 65 and over, even for seniors 65 and over, and as well for people with stable health conditions such as heart disease, asthma, diabetes, high blood pressure, even HIV, hepatitis B and C. And if people have specific allergies or specific concerns, they would just discuss it with their healthcare providers. There's been quite some confusion about what type of vaccines these are. So Pfizer and Moderna, the new generations of vaccines, these are mRNA vaccines, which are built on a new technology, but this technology has been applied for about 10 years or so for cancer treatments or some other disease. So basically, what it does, it gives our body instructions to produce the spike proteins, and the spike proteins which are specific for COVID. So all of the vaccines, including mRNA vaccines, the mechanism how they work, they stimulate immune system of our immune system and to produce antibodies in response of something alien in our system. So this is the natural reaction of our response of our immune system to produce antibodies. So those mRNA vaccines, they'll give instructions to produce the spike proteins. And then the mRNA, it actually breaks down. It doesn't stay longer. This is the delivery mechanism of those spike proteins. And when the immune system recognizes something alien, it starts producing antibodies. So when next time people encounter those spike proteins coming from infected person, they would have already protection in place. And the new vaccine, which has just been approved, this is so-called virus vector vaccine, which uses a slightly different method of delivering those spike proteins to our bodies. So it uses the harmless adenovirus. It does not cause COVID-19 or any infection, but it just uses the very common virus which many people experienced in their life already as a delivery method for those spike protein to us. And again, when immune system encounters something different, it produces antibodies. So all of the 3 vaccines which are approved, they use a similar general mechanism of developing antibodies in response of something new and the building immune response. In terms of rollout, we all abide by the provincial regulations, how vaccines going to be distributed, and we know that we use the province use the ethical framework of vaccine distribution. And as much as we would want on the city level to speed up the process, we would still go by those regulations which were applied on the provincial level. And now, since the start of March, following the immunization of the hospital employees, a major portion of healthcare workers, and most seniors in the congregated livings, which is long-term care or retirement residences or indigenous communities, now they starting adding people 80 and plus, as we heard from the news, and also people in the shelters or community living. And I'm sure my colleague panelists will talk slightly more about this. And we're looking at this period starting from now up till July. This will be the broad start of mass immunization, how all the mass immunization slowly but gradually will have a chance to receive a vaccine. And we're looking finally at August and onwards for all Ontarians to be able to receive a vaccine at no cost. Even people who don't have a HIP card, they will still be able to receive the vaccine just using the different forms of ID. And again, this is current as of today, and with more vaccine supply, this may change in terms of the process may be speed up a little for the receiving. Many people asking when can we receive the vaccine. To be sure, so once you're eligible to receive the vaccine, you will be notified on the clinic location and how to book your appointment. We'll talk more lately, probably in the Q&A session, how people can make those appointments. But just generally, if you have received a flu shot or another vaccine, you should wait for 14 days before making your vaccination appointment. This is something to consider. On the day of your appointment, and this is just again for us, everybody to be ready. On the day of your appointment, you should screen yourself for symptoms of COVID. And if you have a fever or feeling unwell, you should stay home. Please call and rebook your appointment, no matter how urgently you would like to receive the vaccine. If you're not feeling well, if you have fever, you should still stay home. And just a general recommendation to wear a loose sleeve shirt or shirt just to be prepared. All we know that the vaccination has huge benefits. It can help us getting out of pandemic. Vaccine has been tested as safe and can protect us from serious illness. Getting vaccinated will reduce the personal risk of getting sick and give yourself a peace of mind. We're still learning more how vaccine will be effective for transmission, which means getting somebody sick even from person who is asymptomatic. And until we know more, even after receiving the vaccine, we should all practice the most current public health measures, wearing a mask and practicing physical distancing and washing cleans and practicing respiratory etiquette as much as possible. And of course, getting vaccine is voluntary, especially now it's even very limited supply. And we're trying our best just to deliver this chance for as many people as possible. And just to finish with, again, wishing everybody to stay safe and healthy and wearing your mask properly, washing your hands properly, and staying home if you're sick and observing the most current public health measure. Thank you very much for listening, and I'll pass the word to other panelists. Thank you.
Okay, Marina, thanks very much for that presentation. Jason, could you make a brief presentation on your role and how this plan is going to be put forward in East Toronto?
Yeah, just seeing in the chat and hearing people are very anxious to know when is my turn to get vaccine. And let me just share with you a little bit about the plan that the East Toronto Health Partners have put forward. I'm not going to give you a slide deck, but I will share with you some details about our planning process and what the time and volume of vaccine we're hoping to roll out will look like in the coming days, weeks, and months in East Toronto. So the East Toronto Health Partners, in my role, I'm one of the lead organizations at the leadership table, along with VHA, Wood Green Community Services, the East Toronto Family Practice Network, Unity Health, the Providence site, and and community members as well, advisors, family and caregivers, and Michael Garron Hospital, who has been doing an incredible heavy lifting in terms of vaccine rollout in our community in a variety of ways. We have an additional over 50 partners of communities agencies that make up the East Toronto Health Partners. And so what we're doing, our vision is to vaccinate East Toronto residents as quickly as possible. And we will be doing that in alignment with provincial direction and vaccine availability, and working in collaboration with trusted community partners and residents. And obviously in lockstep with our partners at Public Health. Our plan in East Toronto has two pillars. One is a set of mobile vaccine teams that will go out to community to reach people where they're at, and accessible COVID-19 immunization clinics, some of them fairly large scale, and down the road in primary care and family practices, and hopefully beyond that down the road. So our reason for starting with these two pillars, mobile vaccine teams and clinics, is to reduce all possible barriers to getting vaccine for those who will have challenge getting to vaccine clinics. Our philosophy is to literally and figuratively meet people where they're at, so that we can get vaccine to the people who need it the most. So this week alone, between March 1st and 7th, we have mobile teams going out to do the following. So seniors living in congregate care settings like assisted living, we anticipate this week that we'll do about 1,200 doses of home-based visits for vaccine for seniors living in congregate care. As was just this weekend, the addition of people who are homeless and living in shelters was added as the highest priority, which we've been advocating for. And with our colleagues at Toronto Public Health, we anticipate in East Toronto being able to administer about 500 doses this week in 3 to 5 different shelter settings. And we hope to get through all of our shelter partners in the next few weeks. And then thirdly, this week, clients of community health centers and other family practice offices who are 80 and over, we're starting to do this as a partnership with the CHCs and the East Toronto Family Practice Network. And through that mechanism, we anticipate administering another 1,000 vaccines this week. So that's what we're doing in East Toronto. So one of the things that will then pair with that kind of proactive outreach model is creating fixed site immunization clinics that could be large scale and accessible to a lot of people. These clinics are not yet open to the public. Right now, there's a large clinic running at Michael Garron Hospital that right now has been open since December 22nd for eligible healthcare workers. And that continues right now. Moving forward, early March, so in the next week or so, Warden Hilltop Community Center will open up in the northeast of our geographic area for pre-booked appointments for eligible priority populations. So these will be based on age, demographics, and other risk factors. And that will open next. And then we've got 2 other large vaccine clinics that we anticipate opening. We don't have an exact date for these 2. One is the Thorncliffe Park Community Hub, which is in the mall in Thorncliffe Park at 45 Overlea Boulevard. Planning is underway, it's not operational yet. And then the 4th large vaccine clinic we plan to open is at Jimmy Simpson Recreation Center on 870 Queen East. Again, not yet operational, but planning for that is underway. So we know that people are really eager to get into the queue. And at this point, we are working on developing an interim online form and call center for people 80 years and older that want to let us know that they want an appointment. So we're trying to figure that out. We also, eventually, we will move to the provincial pre-registration system or booking system. But while that's not online yet, we are looking at options for that. And essentially, we have, East Toronto is made up of 22 neighborhoods, many of which are geographic communities that need an equity-based approach. And that's one of the things that I'm most proud of about the East Toronto Health Partners is a significant approach to health equity and really going where it's going to matter the most. So we are obviously following provincial and Toronto Public Health guidelines, but we also know our community well, and we know how to reach people through those partnerships best. So we're going to keep pushing to make sure those that are most at risk get access to this vaccine as quickly as possible, just like we did with our testing strategy. I mean, I think one of the things that you all who live in the East have seen is the way in which we lifted up together community-based testing sites that were geographically based on where people needed them. We're supported by community agencies and partners with peer ambassadors. We're going to use the same approach to getting vaccine to the people who need it the most. And I think we're at that very difficult time where waiting is the hardest. We can see it right there. And everybody's like, how do I get there? And I know there's some specific questions that I hope we can get to and answer where we can. And I know Dr. Shamji can answer also some of the specific questions about the science and recommendations around vaccine and those types. And I will stop there and then maybe turn it over to Dr. Shamji, and then we can get into questions.
So I just want to say thank you so much, Jason, because I think that you've given people so much comfort to know, for instance, that there are going to be those mobile sites going out. I mean, because that's a lot of the questions we have got is like, how are we going to get there? So that's just huge. And also knowing that that health equity piece is in place. So, and just knowing that you guys have a plan, because I think that's what, you know, people have been desperate to find out. Thank you so much. Dr. Shamji, over to you.
Perfect. Thank you so much. I wanted to begin by saying what an incredible honor it is to be speaking amongst this esteemed group, and to, quite frankly, be able to be talking about vaccines 1 year after we discovered COVID-19 in the first place. And I think just the fact that we're at this place in such a short amount of time is really an incredible feat that we should all be celebrating. But also acknowledging the tremendous challenges and loss of life that has occurred while we've been waiting for this, which is really unfortunate and sad. I'm really excited to talk about vaccines because I see this as the safest and the fastest way to get us back to the lives that we used to live in 2019 and before that. I have for this talk, I sort of would like to bring a little bit of experience drawing on, you know, my formal training in microbiology, and then also the fact that I've had the honor really of being able to assist with vaccination, both at Michael Garron Hospital, supervising vaccinations, going into retirement homes, and now assisting with the vaccinations amongst our most vulnerable individuals within the shelter system and amongst our Indigenous populations. You know, I remember when I was vaccinated on January 1st, what an incredible feeling of elation and relief that I felt. And it is just so incredible to be able to watch as hundreds of other people receive their vaccines and experience the same moment. And I hope that that moment comes very quickly for all of you. Having participated in, helped to organize, and supervised many vaccination efforts within the city of Toronto, I wanted to reiterate how safe I have observed the vaccine to personally be, and to reflect on the fact that I had 0 reservations when I was one of the first to get vaccinated on January 1st. And I will have 0 reservations in making that recommendation to my family. I want to reassure everyone, and I know that Jason will agree with this as well, that we are working as humanly fast as possible to bring all of the vaccines and all of our resources to bear to end this pandemic and to ensure that everyone has fair, rapid, and equitable access. And I want to emphasize that equitable access is one of our top priorities. Many of us have been advocating very hard for, on the issue of equity and making sure that the vaccines go out to the people that will benefit from them the most. That's been sort of one of the reasons that the provincial scientific table has made recommendations for vaccinations to be prioritized for certain professions, certain age groups, and certain locations. There has been very special attention, as has been recently announced, to supporting marginalized populations, including our shelter system and Indigenous groups. And I'm very proud of the advocacy that has taken place in order to make sure that these groups who have historically less access to healthcare receive the safety blanket that will ensure that life can return to normal as rapidly as possible for them. The vaccines are extremely effective. Marina spoke to them being effective on the range of 62 to 95%. But the one additional thing that I would like to bring is that that statistic is for preventing infection. When we look specifically at the ability of the vaccines to prevent severe infection and severe outcomes, they are almost 100% effective. And I say that specifically not just about Moderna or Pfizer, but about the AstraZeneca Oxford vaccine as well. You know, as I've been telling my family and my friends and everybody who asks me, when the option comes to get a vaccine, I wouldn't, you know, within the parameters and the guidelines that our government and our scientific table has set, if a vaccine is offered to you, I would have zero hesitation in accepting the first one that is offered to you. As Jason and Marina were talking, I was scanning some of the questions, and at the current moment, we have 70 questions. So I know that I hope that nobody will accuse me of skipping over questions, but I have been trying to categorize them a little bit. One of the very frequent questions that has already been coming up has been the news that was actually announced today in regards to the AstraZeneca Oxford vaccine being recommended in individuals under the age of 65. And I wanted to just briefly respond to that. The natural inclination will be for people to assume that it is not effective in individuals over 65. And actually, when you look at why that recommendation was made, it was made because we just are waiting for more data in order to demonstrate that. And especially when we know that we have other vaccines such as Pfizer and Moderna that had actually robust groups of individuals who were over the age of 65 in their studies, we can feel comfortable until we have more data about the AstraZeneca Oxford vaccine in over 65. We can feel comfortable saying, we just want to wait a little bit longer. The fact that that recommendation has been made, I think should actually give all of us a lot of reassurance, because it speaks to the fact that our threshold for certainty and our scientific threshold for feeling comfortable with something is very high. And until that very rigorous threshold is made, we will not rush into doing things without having all of the information that we feel we need to have in order to make a strong, safe, and equitable recommendation. So at the current time, the announcement has come out saying we are going to offer it to individuals under the age of 65 only. If a few weeks from now or a few months from now, that recommendation changes, which it would not surprise me in the slightest that it would, that should be taken again as evidence that we have waited until that scientific threshold was made before doing that. Another question that I saw was, when will children be vaccinated? My response to that is actually quite similar to the one for individuals over the age of 65. We really want to make sure that we have the evidence for that, and they were not included in the studies. Pediatric vaccinations are usually formulated a little bit differently from adult vaccinations, and so we need some more time in order to address that. Another question was, when will other health professionals get vaccinated? So perhaps Jason or Marina can speak a little bit more to this, but there has been a very intense prioritization. It's actually quite clearly laid out. One of the questions was about dentists. My wife is a dentist. I'm keen for her to get vaccinated, but we have discussed amongst ourselves how important it is for us, for her to wait her turn, even though we're very anxious for her to get that vaccination. And so she will certainly do that. And then one quick question that just immediately caught my eye was a concern that I've seen perpetuated a fair amount, which is whether any of these vaccines actually change genetic material within ourselves. And it is scientifically impossible. So in the case of the Pfizer and Moderna vaccine, they are mRNA vaccines. There is no process within the human body that can turn mRNA back into DNA and then integrate it into our cells. And in the same way, the necessary steps for the AstraZeneca vaccine, which does actually contain DNA, there is no way in the human body for it to work backwards. We simply don't possess the enzymes. So I wanted to reassure that even with my formal training in microbiology, where we looked at a lot of this, and we do engage, in bacteria and viruses and genetic studies in that kind of way, I am not aware of any way in which this can actually modify your genetic material. So I want you to rest assured in that. Jason, I'm not sure if, or Marina, I'm not sure if you can speak a little bit more to that, or whether we should address any other questions.
Dr. Shamji,
sorry, Peter.
I'm going to interrupt because I'm going to go to a number of the questions that have been sent in. And I want to thank the three of you panelists for getting things started. Rima and I will be splitting the questions between us, and I'll be starting off. And actually, Jason, you're on screen, and so that's very handy. This first question I have is from Willie. Could you please expand and clarify how seniors over 80 will book their appointments for vaccination? I think I heard that they will be notified. How and by whom?
So this is the crux of the how do you get access to the vaccine? Yes, if you are over 80. So there's a couple of things. If you're in East Toronto and you have a family doctor in East Toronto, one of the things we're rolling out is over 80 clinics in primary care settings. So one way is through your family doctor. The other way that's going to come out in there, I saw in the flow of questions, when is this provincial online place to register going to go live? And what we understand is it will be the week of March 15th, today being the first day of March. So in 2 weeks, there will be a provincial online portal where you can self-register for access to vaccine. And we understand that you should be able to access that week. So that's 2 weeks from today, basically. Having said that, we don't have this up and ready yet. In East Toronto, we may, and we're exploring this right now, create something before then where you can let us know that you want on that list. And we will potentially, with also a place to call in, potentially, and see if we can do that before the 15th. We're not sure yet if we'll be able to lift that up locally, but we are exploring that as an option right now. And if we do, we will blast out to the community very loudly that that's available. So we'll do that through the offices of Peter and Rima. We'll share out our East Toronto Health Partners website news link, and you can check that every day, and it will tell you, okay, there's now a way to do this in the next 2 weeks if we are able to do something before then. We haven't yet, we will, if we do that, we will transition to the provincial online booking system when it's available, and that's 2 weeks from now. And in terms of East Toronto, because I know part of the question is the numbers seem low, like why is it so slow? Is it about the accessibility of vaccine? So some of it's about supply of vaccine, and some of it's about making sure we're doing this in a sustainable way. You'll remember we went really fast at the beginning and then ran out of vaccine. And that didn't work out so well either. So it's a little bit of striking the right balance. Having said that, we anticipate if vaccine keeps coming in, that locally, our plans are for through March to be able to do about 5,000 a day, and by April up to 10,000 a day locally. That's what we're aiming for. So that will have to be based on being able to receive enough vaccine to do that, and to get enough people set up in a way to do those mass vaccine clinics. The only way to do that large number is some of those very, very big clinics that I described. The outreach, we'll continue to do outreach alongside that, but it doesn't let us lift up the same volume, but it allows us to be more specific about reaching people. So I hope that answers that question.
Okay, thank you very much. I'll try the next one. You may be the right person for this, Jason, but the other two panelists may have something to say. From a Sandra, I have a lung disease and I'm on oxygen. I'm 73. When would I be able to get the vaccine? And there are a number of other people she knows under 80 with chronic conditions who are very vulnerable. How are they dealt with in the system that's been brought forward? Jason, are you the right person, or would it?
I don't know, Marina, if in terms of the priority, the age cohort in the chronic disease status, that this would be a high priority this person would be very high priority for a vaccine, and none of us would want you to wait a day longer than, honestly, I think the answer we would have is you should probably be able to get a vaccine as soon as possible. In terms of the rollout plan, going by age cohort and complexity, it would be probably, from what I've read, and I say this by what I've read, because we'll continue to do local things that will hopefully advance a more aggressive approach based on age cohort and complexity alone. You'd be looking at probably April, but that's from what I've read.
I can add to this.
Yes, please.
Again, it depends in this scenario. It depends which stream this specific patient would be eligible. As Jason just mentioned, if you're applying for East York, you can contact your family doctor, which are participating in this community initiative or community program. This can immensely speed up the process. If we would go as for the general requirement, the general regulation, the provincial regulation, as for now, I'm looking at 70 to 75, this age population would be eligible in May, starting May 1st. So this would be the mass immunization. And again, going by 5-year increments, this 73 brings us to May 1st. Again, this situation may change depending on vaccine supply. They may recalculate those stages and those steps. But again, the fastest way to get vaccine in this situation with person with chronic conditions, which is 73 but not eligible for 80 age and plus category, I would suggest what Jason mentioned, to contact and to explore the opportunity getting in these pilot projects. And again, there are many pilot projects happening, and communities and community health centers, which are partners of Toronto Public Health, they get in special funding also for rolling out vaccines for their patients and their staff. So this would be on a local level. Again, it's very, very, I know it may seem frustrating for people, but people who want to receive it, they may explore the possibilities. Still, I would want to tell everybody to be patient, because we've been very patient waiting for the year, and we also should realize that the moment we receive vaccine, it will not, unfortunately, let us out all and start getting back to normal once of a sudden. So even receiving a vaccination, you still need to stay at least 2 weeks, and then you still will have to practice physical distancing, wear a mask, and everything which the public health measures in place, they would still be there until we all getting vaccinated, until we see what is happening. So just please be patient, just explore your opportunities, and try to begin positive with this. Thank you.
Okay. Thank you
Maybe to
very
add
much.
one more thing,
Please go ahead.
just one of the things that we focused on is congregate settings. So where you live matters, and whether you can isolate. I know everybody's exhausted by being isolated, and it's causing its own problems. And that's why I think the push to get vaccine out as quickly as possible. We'll still need to do many of the precautions, as has been said, after vaccine to remain safe. But part of why we're rolling out, so for example, if you're in your 70s and living in some kind of congregate living setting, that may be faster than if you live independently, because it's harder to be isolated in that space. So some of that focus on those pilots of going to those settings is about a recognition of, do people have the living circumstances and situations that allow them to isolate safely? Understand, and I don't say that flippantly, because I know isolation has become its own significant problem for many people. But the relative safety of having a space where you can live independently and isolate is part of why it is stratified that way.
Okay.
And some.
Thank you very much for that. And with that, I will turn it over to my colleague, Rima. You have the next set of questions. Rima?
Thanks so much. And maybe I can just sort of pass out. We get questions from people who are not in the obvious priority groups, but who feel very, very anxious. And these include people who are under 60 but have chronic conditions who are immunocompromised in one way or another. They include teachers of children in daycare who, the kids aren't wearing masks. We don't really know what the kids are carrying. We know that generally kids are, carry all sorts of stuff. Kids carry stuff. So daycare folks are scared. And then also, people who just are working on front lines, dealing with lots of people, particularly when we don't have paid sick days available. And we know folks are working when they're sick because they can't afford to not to, or they're afraid they'll lose their housing. So people who are working frontline, on the front line, or who are essential workers, and those especially who are working with marginalized populations, all of those folks are not sort of scheduled for priority, but are really concerned. What are your thoughts about how they should deal with this? Thanks.
Maybe I can start answering, and then my colleagues will pick it up. Actually, there is a lot of advocacy already has been put in place to prioritize, to push further for frontline workers, including teachers. And as of last Friday, the provincial regulations have been changed, so the dates and populations included in each stage of vaccination have been changed already. And we can see, if we go on the provincial website, those second phase already list frontline essential workers, including teachers, which would include teachers of the child and daycare centers, as well as food processing industry. When exact in the second phase it's gonna happen, again, it's not quite clear, as not more details, more refining are coming up from the province in terms of the details, who and when. But again, we just on the Toronto Public Health side and on the community health clinics, we still getting ready to deliver as soon as possible. Thank you.
I wonder if I can add just a little bit of a follow-up to that question. I think one of the challenges is that despite all of our best efforts, there's a finite supply of vaccines. And what that means is that there is an opportunity cost. If I offer a vaccine to one person, it necessarily means that I can't offer that vaccine to someone else. We are very much focused on equitable distribution of the vaccines, and we are trying to use science as much as we can. Recognizing that, even despite our best efforts, we will not be able to vaccinate immediately all of the individuals who are and consider themselves to be the highest risk. And I think that really speaks to the importance of having leaders like yourself, like our members of provincial parliament who have organized this today, to help us navigate with the comprehensive policy approach that includes important things like paid sick days, increased Ministry of Labor investigations, enforcement of rules. I can say, addressing some of the individual concerns that I saw in the chat, such as, around children and teachers. Within our own community, Michael Garron Hospital has been working extremely hard to try and make our school system as safe as possible. So we are beginning to introduce rapid testing for students, take-home COVID testing kits. We're trying to remove as many barriers as possible so that we can rapidly and immediately identify any individuals who could put our teachers, our daycare workers at risk. And we're trying to apply that holistic approach to a comprehensive community safety while we wait to have enough vaccines to get this out to everybody. So we're not in a, it's a less than ideal scenario, but we have to attack it from as many different perspectives as possible. I think our leaders here are doing that. And certainly your community hospital as your partner is doing everything that it can to support those initiatives as well.
Thank you so much. One other question that comes up a fair amount is the question of what folks should do who are pregnant. Where do they fit in? How important is it that they get vaccinated? How dangerous is it for them not to be? Do they just go by age group? How do you see that work playing out?
I might tackle that question. It is a very good question and one that comes up a lot. I would start out by saying that we have limited evidence but it is some evidence to say that there aren't actually any safety concerns in pregnant individuals. We did speak to, or I did rather, to the sort of high threshold before we can say that conclusively. The Society of Obstetricians and Gynecologists of Canada, which is, the authoritative voice on obstetrical pregnancy concerns amongst healthcare professionals in Canada, has come out and said that they do not see any, they have not identified any risks in offering the vaccine to pregnant women. However, what we are recommending is that for every individual who is considering becoming pregnant or is pregnant, when the opportunity comes up for vaccination, to have a conversation with your healthcare provider to evaluate the risks and the benefits. In some cases, the benefits may easily point towards getting vaccinated. And in other cases, it may be reasonable to wait a little bit longer. So as an example, my wife and I don't have any children. We are trying to become pregnant. And as I mentioned, my wife is a dentist, which is a high-risk profession. So the arithmetic for our risk benefit calculation would be, without a doubt, for my wife, when she's offered a vaccine, if she's pregnant or about to become pregnant, to go ahead and get the vaccine. If you have a job where you're able to work on a regular basis from home, where you're not regularly exposed to individuals who are at higher risk of having COVID-19, it could be reasonable to wait. That being said, we actually do not have any evidence at all that the vaccine is dangerous to pregnant women, but we encourage you to have a discussion with the healthcare professional that you trust.
Thank you so much. And I guess, sorry, Jason, did you?
Not to add to that, but just noticing a question about pace and age and the volume of vaccine that's been coming up a lot. And a question like, will the East Toronto Health Partners be able to go faster? And I think one of the, I do want to address the fact that Michael Garron Hospital kind of is the vaccine holder and is a steward for those resources and cannot just do what they want with them. And so one of the things that we did learn is, in the rollout, in the first stage of the rollout, if we went really fast and our neighbors to the east or to the north were had groups that were in that higher priority group that, like, for example, in long-term care, then that vaccine and that resource moved to those other resources. And that was something that isn't locally decided. So I just want to flag that we will, in East Toronto, I think we've got a strong network foundation for doing it fast. I think there was a comment about, but we will need to lift up our partners in other parts of the city as well, or at least that's been the case to date. And so the faster we all go, the better off we all are. And to some degree, we'll be working together on that. And it won't be entirely in the control of our network and that can be frustrating. I recognize, I think, for a lot of people, but I've seen that come up a lot, and I did want to just make sure that was also clear to folks.
Thanks so much, Jason. Over to you, Peter.
Okay, thanks very much, Rima, and thanks, panelists. I wanted to say before I continue with questions, we still have about 420 participants, and we have about 125 questions. I've checked with all the panelists and participants. We're prepared to go to 8:30 and try and get more questions answered, because I think these are pretty pressing for people. Those of you who can't stay, I understand, but I think a lot of you are very interested in getting more detail. And again, my thanks to the panelists and the whole team for being willing to stay longer. One of the questions that came up, and I've seen it reflected a number of times, there are currently 3 approved vaccines. Will people be able to choose which vaccine they get? Will certain vaccines be only available to select groups? And I'm not sure who's best equipped for that. Perhaps you, Dr. Shamji?
Certainly, I'm happy to begin addressing that, although I think I think the ultimate answer to that is more of a logistical question. And so Jason and Marina may be able to speak a little bit more to that. As it stands right now, we're trying to get access to vaccine as quickly as possible. And so it's not really, I'm not sure that how feasible it is for us to be able to offer a choice. When I had my vaccine, I didn't know if I was going to get Pfizer or Moderna, and I ended up getting Pfizer. I would say the one to take is the one that you get offered first, you know, so long as you sort of meet the guidelines. So as it stands right now, the only sort of choice, if you will, that may come up is, you know, if you're over 65, you will not be offered the AstraZeneca one.
Okay. Jason, did you want to speak to that, or Marina?
No, I just think I think overwhelmingly, and I think it's not too simplistic to say that the best vaccine is the one that's offered to you at the time. And I think, as Dr. Shamji has said, they all are extremely effective in preventing the worst outcomes of COVID. And you know, today we had a conversation around the outreach to the shelters about the future approval of Johnson & Johnson, which will be a one-dose vaccine. And for transient populations, the idea of giving a single dose is very appealing. At the same time, it is better not to wait for that, given the risks of not moving forward with what we have. And I think that that's generally the best we can do right now.
Okay.
I just want to add a little bit. I would want to agree with Dr. Shamji. This is exactly about logistics, because when we're talking about mRNA vaccines, logistic-wise, they require very low temperatures. So that's why Pfizer, it needs about -70 to be stored, and the Moderna 40 to 50, if I'm not mistaken. So that's why those vaccines were delivered in the hospitals, and that's where they started being delivered in the hospital settings. The benefit of AstraZeneca is that it can be stored with the low fridge temperatures, and that gives us a possibility for use in the mass vaccination clinics more easily, as well as the mobile clinics, which would be critical, how you can store something which needs to be kept -70 and travel somewhere, right? So this is also because of the logistics as well. And other vaccines which are coming, which are not mRNA vaccine, they would be, again, logistic-wise, will be easier to do mobile clinics and use in the mobile clinics.
Okay, thank you. Jason, I think this is yours because it's more logistical. The mobile vaccinations, when will they happen and how will they happen? How will people who are housebound get a vaccination?
Yeah, so the mobile outreach is happening now. So we've started with mobile clinics in, as I say, congregate settings. You know, really the first mobile work was in long-term care and retirement homes. Now we've moved to other congregate living situations for seniors. We're starting with shelters, and then we will keep going. So if we haven't, again, it will be, so that mobile strategy will continue, and we'll keep adding locations. So it could include, for example, homebound seniors who are living independently as we go. And that will continue to happen. To some degree, you know, if somebody is homebound, they do need to identify to us that they need the service down the road, or through a care provider, whether that's, if you're receiving home and community care, that's a way to be identified as needing a homebound outreach, or through your primary care provider. And then we're going to keep doing mobile outreach. That's one of our pillars, and we'll keep doing that and expanding on who has access to that as we move along in our rollout of the vaccine.
Okay. Marina, this may be more related to your area of expertise. I've asked, or what we've been asked is, church groups and other NGOs who work with food banks and the homeless, marginalized communities directly, are they considered frontline staff or essential workers?
I wish this question would be for me, but I would have to refer this question for the provincial, because everything regarding vaccine rollout and prioritizing populations, this is the authority of the province. So that needs to be very clear who is responsible for what. So everything about vaccine approval or getting those vaccines, this is Health Canada authority. This is the federal level. Then it gets down the vaccine to the provinces. Each province decides on its own vaccination plan. And as a public health unit, we have to abide by those provincial regulations. So that's why we're looking patiently up to the province to decide about the details. We know frontline essential workers gonna be in the stage 2. Vaccinated somewhere between now, April and July. When exactly it's going to be and the exact professions, populations against the age, all the details are coming up. As soon as we find out, all the updates are going to come on Toronto Public Health website.
Okay, thank you. The next question I have is, will people without OHIP be able to get the vaccine? Dr. Shamji, could you speak to that?
Yes, certainly. So yes, the vaccine will be offered to individuals without OHIP, without even ID, or even if they don't have official status in Canada. And the reason for that is when we protect the health of our most vulnerable, we protect the health of all of us. We've certainly seen that. It's one of the reasons that we've prioritized Indigenous populations and we've prioritized our shelters. Currently, we have many outbreaks within shelters right now. And if we don't immediately address that, not just for equity reasons, but for healthcare resource reasons, if those outbreaks persist unabated, they will occupy all of our ICU beds. And so for equity reasons, ethical reasons, and for healthcare system resource reasons, I'm proud to say that our government has prioritized vaccination to anyone and everyone.
Okay, thank you. And I have another question before I turn it back to Rima. Is the testing easier for kids now? My 5-year-old had the upper nasal swab last year and it went poorly. I'm not sure he'd handle another one. Does Michael Garron Hospital do kid-friendlier testing that is accurate?
I'm happy and so relieved to be able to answer that, because through this summer, we unfortunately were continuing to offer nasopharyngeal. Well, the only test we had was the nose test that goes deep in. And unfortunately, we had no choice because we had suspicions about better ways to do it, but we couldn't prove that they were equally effective. And now the manner in which we test is much more easier and palatable to children. So we take a swab, we draw a little circle on the inside of the right cheek, of the left cheek, little tickle of the tongue, and then the probe just touches the inside of the nostril in both sides, barely going in. And we have been able to, and we now offer that to all individuals under the age of 18. And we are happy to do that because we've demonstrated that that is as effective as a nasopharyngeal swab, the traditional swab in adults. So you can rest assured, if I hope your child doesn't need a swab, or a test, but if they do, it will go much better than the first time around.
Okay, thank you very much. A last question before I turn it over to Rima. I live in Riverdale and I'm the caregiver for my 90-year-old mom who lives by herself in North York. Can I sign up and take my mom for vaccination in East York? Jason, I'm guessing you would be the person.
The short answer is the vaccine clinics, as they open up, assuming that your mom is living independently, as soon as you're able to sign up for over 80, you can sign up where it's most convenient to take your mom for her vaccine. There will be a number of the city-operated mass vaccine clinics, and those sites are already public. And then I've shared with you where we're going to be launching as well in East Toronto. So there's not going to be, it's going to be what's easiest for you to organize and book for your mom is the short answer to that question.
Okay, thank you. Rima, with that, I turn it back to you.
Thank you. And Dr. Shamji, I'm sure you put a lot of parents' concerns to rest, because I can't imagine taking a 5-year-old to get tested the deep nasal swab way. But my question, the question that I saw, somebody asked it who must have read the same news article I did, that South Africa was very reticent to use the AstraZeneca vaccine for fear it wasn't actually working on that variant. But you've been saying it's fine. So can you square that for folks who are concerned?
Certainly. And of course I read that as well. And I found actually their decision to be very curious, because if you actually read what their justification was, they said it's not as effective for mild or moderate cases of the South African COVID-19. And as far as I'm concerned, I mean, I wish that it was equally effective in mild, moderate, and severe, but the cohort that I care the most about is the severe one. And so, even in their own announcement, they acknowledge that it is effective in the severe case. Now, it may well be that logistically they have ample supply to the Pfizer, Moderna vaccines and some other ones. And so they had the luxury of being able to say that. I think if you hand me a vaccine that will prevent, severe outcomes, I will wholeheartedly embrace that. And so I'm not particularly worried about that. I mean, I am observing the fact that, with a couple of these variants that are out there, our current vaccines may be slightly less effective. That's a possibility. And we don't have robust studies to quantify that quite at this time. Everything is sort of correlational. But everything that we're seeing so far says that there still is at least a substantial amount of effectiveness of all of the vaccines, including the AstraZeneca one. And in particular, the beauty about the Pfizer and Moderna ones is they can be so rapidly modified to address variants that I think it's frankly a technological miracle. So I'm not concerned by about the news that came out of South Africa, and I'm still convinced and comfortable that we've approved the AstraZeneca Oxford vaccine in Canada.
Okay, thanks so much. Somebody's written to say that she is actually aware of many people who are very hesitant to take the vaccine. And she's wondering what strategies you use to convince people to take it, perhaps so that she can talk to friends and relatives and neighbors and so on. And I wonder if you have any tips to share.
I'm sure all of us can share a little bit of advice on that. It's a conversation that I have frequently with friends, family, and then of course, professionally within the hospital, within the shelter system. I think, the first thing to lead these discussions with is coming with it from a compassionate and non-judgmental perspective. I can't emphasize how important that is, because most people who are experiencing fears or expressing hesitancy about taking the vaccine, they're not doing this in any way that is malicious or trying to undermine the public healthcare system. They're doing that because they're concerned and because they might be afraid. And I think that's a really important undercurrent to acknowledge before even having these conversations in the first place. Recognizing that, I think it's important when discussing issues around vaccine education and hesitancy to do a lot of listening. I think a lot of those concerns and those fears will come out. And then once you have a better idea of what those are, you can, I think the way to proceed is to provide, non-judgmental education and pointing people in the right direction. I also think that if you encounter someone who's worried or extremely hesitant, I don't think that it's realistic to expect to change their mind in 5 minutes or in a single visit or 2 visits. Again, I think it's important to listen, hear the concerns, offer opportunities for education, and be willing to listen and hear their concerns over and over and over again. I think already from the very first weeks in December, when those really moving videos of the Pfizer vaccine coming off the airplane, and many people being excited, but even more people being afraid. As we get more experience with the vaccine, as we look amongst us and see millions of our fellow citizens and fellow human beings around the world getting vaccinated and not having the adverse effects that some people are afraid of, I think with time, we will also get there as well. So I wouldn't worry too much about changing minds immediately. We'll get there together. And if we push too hard, we actually run the risk of doing more harm and undermining the trust that our friends, families, and other professionals have in us. So that would be my main advice going forward.
Those sound like very wise words. Jason, Marina, do you have anything you'd like to add?
I would first of all say I couldn't agree more, and I think I would add a couple of things. I think one thing to recognize is that people who have significant distrust of vaccines or the healthcare system, sometimes that distrust has been earned, and sometimes that distrust has been earned over many generations. And I think so our approaches to these conversations are different for different communities. They need to be different because that place of distrust may have come from a very different trajectory in history, and that context is really important. So when we look at the legacy of colonization and anti-Indigenous racism and the role of the healthcare system in that, the obligation that we have to our responsibilities under the Truth and Reconciliation agenda that we have to reestablish trust in a very authentic way is essential. And if we aren't doing that work, we're not likely to see that kind of trust translate quickly and easily. And so I think as healthcare system leaders and providers, that's a big part of our work and responsibility. We need to be doing that all the time if we're going to be successful. There are different histories and different fears that have been created in different ways. I think the approach is going to be different for different concerns. I would say patience, repetition, and the other piece is, and we're doing this in the East, others I know across the city are doing this, is really working closely with communities from a community development perspective so that the knowledge is translated by trusted community members, by community leaders, by ambassadors within communities, and not just top down from healthcare professionals. And I think that is, that's another essential way forward. And that's how, it will be incremental, but otherwise I completely agree with Dr. Shamji.
Thank you so much.
I would also want to briefly agree, and I can't agree more with Dr. Shamji and with Jason, that we experience that the more there is a push, the less there is a trust. And what we're trying to do, we're trying to build the trust, and we're trying to build this confidence. And in these terms, Toronto Public Health places a huge amount of efforts on education, because we know not only about vaccines, all the fears or all the misconceptions, they're coming from the lack of education, of lack of knowledge, actually. So then people can buy anything, any news so they can hear, they can just go for this. I like personally, when doing my presentations in the community, I like saying that it needs to be taken individually and to build trust with each in every single individual, and then the positivity of this, the sharing of knowledge, then will just keep rolling. And for many people, what I experienced, it's sharing the link for the trusted sources of information. And they're saying, instead of listening for the news, which exaggerates sometimes the problem, why don't you refer to the Health Canada website? Because there is a huge amount of information, how vaccines have been developed, how they have been approved, what are the exact ingredients, and you can just do your research, just look at all this information which is available public. And that's, I think, the beauty of the public websites, because and making information transparent, this can also create some kind of trust, because if there is a chance to see what is there and to get your knowledge and build your education on this, and it's very important to make this informative choice, and then you will be understanding that you're making informative and confident choice for yourself and for your family members.
Thank you so much. And I'm sure I speak for Peter as well when I say that any tools that you develop or that you have access to that you find are particularly successful in building trust, we would be happy to pass out to folks who come to us for information or who have questions, because that happens as well. Another question we've received is, what do people do who either don't have access to the internet or just aren't very comfortable using the internet to do things like book appointments? How should they go about getting access to the vaccine?
I mean, the very quick answer is there will be a phone-in option as well. And I think in my earlier comments, when I talked about us trying to think about what we might do before the provincial platform is available, one of the things that we know about our community is that we need both an online and telephone option to reach everybody. And even then, there's going to be challenges. So people are going to have to be able to walk in. Like that's challenging in a bunch of ways. One of the biggest projects we've had underway, or one of many big projects, is addressing the digital equity divide in our communities. And that includes just access to a phone with minutes for the community members sometimes. So we've been, in addition to other things, collecting phones and SIM cards and getting donations and giving them out to people who need them so they can communicate with our systems. And I think that that's part of the solution as well. But other people need support to do that. So that's where our community partners and agencies come in also to help facilitate access in a bunch of ways, and neighbors and friends. But there'll be the online, there will be a phone option as well. Certainly, that's a minimum piece. And then we're going to have to, and that's why a part of our pillar is to go out to where people are, is to make it easier.
And is there going to be a possibility at some point for people to just walk up to a place and register?
For no appointment based, yeah, I do think that that a certain amount of non-appointment based access will be necessary to get ideal coverage. But I don't have specifics about how that's going to work yet. But I think we're going to need that.
Okay, Peter, over to you.
Thanks very much, Rima. Continuing on, we have a question here. We have a family member who's 101 years old, living in supportive housing for frail seniors run by Wood Green. It's not a long-term care facility. We've heard nothing about vaccines for him or any of the other seniors there. What are the plans for addressing the needs of those residents? I think, Jason, you may be the person.
Yeah, I mean, I think the short answer is that building will be on a list for mobile vaccine. I don't know the building or the date. But those are exactly the settings that our mobile strategy will be tackling as we go. So, I would encourage the person who asked to reach out to staff at Wood Green. They may know already when mobile vaccine will be available, but if not, it may just be that we're scheduling and getting to all of those folks over the coming weeks. So that would be exactly the kind of site that we would be doing our mobile vaccine clinics.
And is there a place, is there a way that people can find out which seniors buildings are on the list of those that are scheduled to be done in the next few months?
I will get, I don't know the answer to that actually immediately, but I'm happy to go back to my partners and come back. And if that person wants to give a contact, we can reach back out.
Okay, that's fine. Another question here, what is the goal or deadline for vaccinating all East Enders? Is there a timeline working backwards with weekly targets communicated in order to meet this end goal?
It's a great question. I think this might be something that I will try and answer, and I will do only a partially good job. So I apologize in advance. I think when we looked at how quickly we could, if vaccine keeps coming, if we could do up to X number of thousand a day, we can then model that out, right? And we know we have about 300,000 residents in the East that we're responsible for. That includes folks who maybe won't and can't get vaccine as well, right? So depending on age cohort and that sort of thing. So based on, if we had an unlimited amount of vaccine and the ability to do the mass vaccine clinics, as we had predicted, we could then say, yeah, it would take 3 to 5 months, 3 to 6 months based on those numbers. It will depend on things that we in the East can't control, which includes the flow of vaccine to us. But what we were planning to lift up would allow us in theory to do upwards of 10,000 a day. So it's not hard to kind of do the math on that to get you to the 300,000. And I think that that's what we're trying to lift up by April or May. And then, but really it's going to be, a lot of it's going to be determined by access to vaccine.
Okay. And another question here, what's the plan for no-show appointments? In the United States, there are pleas for people to come in and be standby recipients in the event appointments are missed so that the vaccine won't go to waste. Is that something that's going to be addressed in the East End and the clinics that are being planned?
The short answer is so far, yes. And so a no waste approach has been a priority. So we've had for the pilots and things like that, we've had backup lists. So if somebody doesn't show up, that we have the next people in the queue to call at a certain time so that we don't have any waste. So that has been what we've been doing to date in the work that I've been connected to. And the goal is not to waste any vaccine.
Okay. And we're asked, will pharmacists be authorized to administer the vaccine off their pharmacy premises as they were with the flu vaccine last year? If so, when, and will there be a separate registration for them? Would that be you, Marina, who would address that?
I may try. It's still, there is a plan to include the pharmacies, and there is also a plan to include the primary healthcare providers as well. Again, the final details, we're waiting when and how they can register for this for the province. So it's all up to the province. They keep, but just from the previous 2 weeks, they were pretty good in delivering the updates. So let's just hope that the next update, they will make a decision pretty soon.
Okay, thank you. One question that's come in speaks to the desperation a lot of people feel about getting their vaccination and the potential that they will come in to get their vaccination even though they're quite ill. Perhaps they are able to cover that up. Do you have a way of addressing those fears so that if someone is ill, they don't feel that missing the appointment means they'll go to the bottom of the list? Jason, Marina, would that be your field?
I can start because on the day of vaccination, maybe Jason and Dr. Shamji will know better for this, but what we say, because they would need to fill the screening questionnaire. So if they have fever, if they have certain conditions, these are all the questions listed on the questionnaire, because each and every individual need to sign the consent form, the screening form, which is also working as a consent form to receive the vaccination. And this would be screened before they receive the vaccine. That's my understanding.
Okay. And
in terms of losing your place in the queue, in theory, you
yes.
should not. You should remain kind of at the same level of priority, and should be given, like, so if my time comes up and I come down with something that's got me feeling unwell, and I screen out honestly, it shouldn't mean that I have an undue wait period after the resolution of my illness. I'm supposed to keep my priority, and so in theory, it shouldn't be that you're disadvantaged, but I appreciate the anxiety. And I know for the healthcare worker side of things, that's been expressed clearly. So we have a bunch of categories in healthcare workers: highest priority, very high priority, high priority. I think I've got that right. I get it confused. Highest, very high, high. And so once you're in the queue right now, for example, highest and very high are being vaccinated. If you now have to wait because you have an illness, it's not that you have to wait until that whole group goes. You're supposed to be able to come back in when you're well in that same priority list. And I know we've had folks in the highest priority list who have had to wait. And then when they're put in, they have not had to wait very long to get an appointment. So that's so far how it has been working for, at least for healthcare providers. So that gives me some reassurance.
Okay, thank you. One last question, then I'm going to turn it back to Rima. And I think, Marina, this is your area. Can you explain who qualifies as an adult receiving home care for chronic conditions? And when and how will this group access vaccines? I know that Toronto Public Health isn't making those definitions, but you would be familiar with the definitions. Can you speak to that?
I know there is this document, which is a healthcare workers guidance on prioritization, which was issued by the province of Ontario, I believe in February or mid-February. And this would be the regulations who may qualify as a healthcare worker, because the definition is really, really quite broad, who may qualify as a healthcare worker. So people who providing the healthcare and attending to the needs of the people with chronic conditions, so they may qualify, but to be completely 100% sure, we need to look at the guidance. So I would refer to the document.
Yeah, in this case, and I'm sorry I wasn't clear, we're not talking about defining the healthcare worker, but how is an adult receiving home care for chronic conditions
Adult receiving
defined?
from home care. I would be hesitant to give the precise definition. Again, we need to just to look at the, so this for people who taking care of somebody, this is this prioritization guidance. For another, it will be ethical framework. So again, for this precise definition, I would just need to go and look in the document. I would be hesitant to go and answer this by hand for the exact definition who may qualify.
Okay, thank you very much. With that, I'm going to turn it over to Rima for our last round of questions before we wrap up. Rima?
Thank you so much, Peter. And one question that's come up is a question of, are people going to be getting little passports that show they've been vaccinated and that, may allow, give them access to traveling or stuff like that? How is that going to roll out? I don't know who wants to take
Dr. Shamji, I mean, so I know that that there is there's a print that when people get a vaccine, because they do get a printout saying with a date and what vaccine they received. So it's on a little piece of paper. In terms of what that will allow you to do down the road, I don't think that there's been any yet to determine. I think we're all anticipating that, for example, international travel, things like that might involve requirements to demonstrate vaccination. But I don't think any of us really know exactly how that will all work or what that will look like. But certainly there is, the system does produce a printout identifying the date that you received your vaccine, and I think what kind of vaccine it was, if I'm not mistaken.
Yes, that's right. So you receive a receipt about that big that kind of prints out just like you get when you go to the supermarket or something like that. And then when I got my vaccination, a copy of that was also emailed to me as well. So I have both of those. In regards to the broader question of if you have that piece of paper or that PDF, will that allow you to go to the bars or to enter grocery stores without a mask on and that kind of thing? And I think, certainly for the foreseeable future, even if you're vaccinated, and I do this as well, we have to continue using the same kind of precautions. Reason for that, number of reasons for that. One, we're getting more evidence, but we're not 100%, we're not extremely confident yet that you can't transmit to others, even if you can't be infected yourself. And the other thing is that we are still waiting on more data to feel confident about how long the duration of protection from the immunization is. And because we're not quite sure about that, and we don't have tests that can confidently, we don't have a blood test that can confidently tell us that you remain immune from COVID-19, it's going to be a little bit, I anticipate it will be a little while before we will be able to say, okay, you can enter this bar, especially without a mask or something, simply because you have the vaccine. That being said, if I was on an international flight, I would prefer to sit next to someone that has been vaccinated. But we're being very careful and cautious so that when we do ultimately give advice, that advice can be trusted.
But even so, it's the entering a bar or going to the grocery store without a mask is one thing, but another thing would be being able to come home from another, like if you're traveling back to Canada, do you have to go into quarantine? Do you have to self-isolate in a hotel if you've had if you've got your little vaccination certificate?
Yeah.
I mean, I think those are the kinds of questions that people are going to want answers to.
And superb question, honestly. And I'll try and illustrate why that's at this scientific point in time, that's a difficult question to answer. I'll answer that by giving an anecdote about another vaccine, which is the hepatitis B vaccine, which is an incredible vaccine. And it makes me very safe from, for example, needle stick injuries when I'm working in the emergency department. But what we know, because we have studied the vaccine for a very long time, is that some individuals do not, even after the hepatitis B vaccine, do not actually mount immunity against hepatitis B. We know how to test and to know who has immunity and who does not. We don't yet have that knowledge level with any of the COVID-19 vaccines. We likely will. But while we're still learning more about, while we're still developing the test and gathering more data about the duration of immunity and about whether some people, about whether there may be a minority of individuals that don't mount a response, we still, for the protection of society and the most vulnerable, we can't, I don't anticipate anytime soon we'll see any recommendations from public health, the Public Health Agency of Canada saying necessarily that you don't need to, that you don't need to quarantine after returning from travel. That may come, but I'm not sure that we're there yet.
I think those are going to be some of the public policy issues that Peter and I and folks like us have to wrestle with. But it relates to another follow-up question that we've received, which is that we actually, because we don't have longitudinal data on the vaccine in any of the ways, like, is that something that people should be concerned about? That's,
That's a very fair, great question. I don't blame people for, there's nothing to blame, period. I have a couple ways of answering that. The first is that mRNA, I hear that question the most within the context of the mRNA vaccines, which have been in development over about 40 or 50 years and have actually been in use, though, for cancer treatments for about 10 years. What we know from the totality of vaccination history and vaccination science is that medium and long-term side effects from vaccines occur within the first 3 to 4 months. We are well outside of those 3 or 4 months. The other thing that gives me a lot of confidence is for each of the vaccines now, we are now at tens of millions of doses administered. What that also tells us is that extremely rare side effects, the kind that happen in 1 in 10 million people, we would have detected by now. And so when I look at data like that, and I look at the experience that we've amassed, it gives me confidence in continuing to recommend the vaccine. And you will note, there are some things that I have been very upfront about that I don't yet have confidence. For example, and unfortunately, this is one that we all want to believe, but whether we can quarantine, whether we need to quarantine, for 14 days after coming back from travel, if we've been vaccinated. I will be frank where there are gaps in the evidence, and that would be one of those. But when it comes to long-term side effects of these vaccines or extremely rare side effects, I feel very confident that I understand why people have these concerns, but I feel confident that we don't need to have them.
thank you so much. I'm going to toss out 2 last questions very quickly, and maybe they can be grouped together, although they're different questions. The first one is the vaccine safe for cancer patients? And the second is where are people going to be notified? Is it their doctor's address where the doctor is in the city, or is it where people live? That's a question that's come up a fair bit. And those are my last 2 questions, and I throw them out for whoever wants to answer them.
I just can briefly answer from the public health perspective what we're telling all the residents when we're doing workshops. People who have cancer, they may have the shot, but if they're taking medications for cancer medication, they would need to confirm it with their healthcare provider. And on the day of vaccination, they would actually need to supply additional form, the confirmation form that they discussed it with their healthcare provider. I've just tried to do brief, so to give a chance for another question.
In terms of where people will get the vaccine, I don't know if Dr. Shamji, you wanted to talk more about cancer and vaccine. I have nothing to add to that, but I can talk a little bit about location.
So just very briefly, I agree with what Marina has said. We know that cancer, cancer is a big umbrella term that actually, refers to many, many different kinds of illnesses, and all of them have their own nuances. And there are various kinds of treatments, chemotherapies, and biologic therapies as well. And so while I strongly suspect that in most cases, most oncologists will strongly encourage their patients to get vaccinated, because of the complexity and the myriad ways in which cancer is treated and in which it manifests, we are encouraging everyone who has cancer to consult with their oncologist. Just to be 100% sure. And the same goes for transplant patients and individuals who are on immunosuppressive therapy as well.
And with that, I'm afraid we're going to have to wind up.
But Jason is going to tell us about the address thing. So,
sorry.
Where you live and where you get your care, it's going to be a mix of those things in terms of where you get your vaccine. So the city's mass vaccine clinics, and the ones that we're going to do locally, when they're open to your age cohort or your group as it goes, you can go where you want to register, and it's convenient for you. Similarly, if you're able to access vaccine through your primary care provider, once primary care is rolling it out, you can do it. It's what's going to be convenient in some ways, and so both. It's going to be a mixed thing of where you live and where you get your care in terms of vaccine access, and you shouldn't be restricted one way or the other, to be honest. So that's the short answer to that.
Okay. Actually, Rima, thanks for intervening. That was an important piece of information. We are out of time. I want to thank all the panelists. They were great tonight. And I appreciate the fact that you're willing to stick in for an extra half hour. That was wonderful. I'm going to turn it over to you, Rima, for the last words, but I just want to thank everyone who's made this possible this evening.
And I just want to echo, Peter, thank you so much for doing this with me. Thanks, Marina, Jason, and Dr. Shamji, for all of your brilliance, for giving up an evening when I know you're all really, really busy people. This was so appreciated by the community. Thanks to everybody who joined us and stuck it out and through most of the time or all of the time. We're very grateful to you. Thanks for your thoughtful questions. We will be sending out Marina's slides, and as we get material on sort of how to answer questions, we'll make sure to make that public. This event has been recorded, and we will both be posting it on our Facebook sites and websites. So if anybody wants answers and wants to watch it, they're more than welcome to. Thanks so much, everybody. And also, super importantly, thanks to our teams, our staff teams in both of our offices. We're so grateful to you. Without you, we couldn't have done this. Thanks very much. Have a great evening.
Good night, all. Take care.